Today's lecture is about the next NCLEX practice-based questions. So let's start our today's lecture. So our first question is, a client named Sarah, age 32, who has sustained a T4 spinal cord injury, is at risk of developing autonomic dysreflexia. Identifying the sign and symptom associated with this clinical disorder is essential for the prompt interventions. Please select the appropriate sign and symptoms commonly observed in the autonomic dysreflexia. Select all that apply. So options will be pallor, blurred vision, tachycardia, increased blood pressure, severe headache, diarrhea, increased blood sugar, sweating. So means, firstly, here the condition given is autonomic dysreflexia, and like we have to select, it is a SATA based question, so we have to select the clinical manifestations. Here you can see the appropriate sign and symptoms or the clinical manifestations that need a intervention. So means in this question, we have to find out the clinical manifestations of the disease autonomic dysreflexia. So let's solve this question. Okay. So firstly, here we will discuss about the autonomic dysreflexia. So here the name indicate autonomic means it is related to the autonomic nervous system. So like it is a condition that emerged after a spinal cord injury, usually when the damage has occurred above the T6 level. So you can see here, like this is the diagram. So when there will be the injury up to the T6 level, so here this condition is called the autonomic dysreflexia. When there is a spinal cord injury and damage occurred above the T6 level, then this condition is called the autonomic dysreflexia. And this condition directly affects the autonomic nervous system. So I will clear you. Okay. So basically, autonomic nervous system, it consists of the two systems, sympathetic nervous system and parasympathetic nervous system. So here, we will solve this MCQ with the help of the diagram. So see here, like suppose this is our brain and this is a spinal cord. Okay. So SNS, we call this thoracolumbar, and parasympathetic nervous system is the craniosacral. Means it starts from the T1 and up to the lumbar 2 vertebra. Means thoracic 1 vertebra to the lumbar 2 vertebra. And here it involves the cranial nerves. You can see here cranial nerve number 3, 7, 9, and 10. And sacral, and sorry, spinal nerves here S2 to S4. So basically we know like the here the like T6 vertebra. So when there injury above the T6 vertebra, here the breakage, you can see here, like in the spinal cord injury. So here the breakage of the T6. But like the basic terms, SNS and PNS, here I cleared you. Like SNS called the thoracolumbar and PNS called the craniosacral, in which the T1 to the lumbar vertebra 2 here, and cranial nerve here 3, 7, 9, 10, and spinal nerve S2 and S4. So you can see here, like the eye movements, eye, heart, GIT, and liver. So these main four categories here. Eye and heart activities controlled by above the T6 vertebra, and below here GIT and liver activities controlled below the T6 vertebra. So you can see here, if there is a condition in the spinal cord injury, there will be no any stimulations, no any signals will go up to the brain, because here is the breakage. So when there is a breakage of the T6 vertebra due to the spinal cord injury, there will be no any message passes to the brain. But here, then PNS try to overcome this situation. So below here, T6, the sympathetic nervous system will be, and then here, to overcome this condition, here the PNS will activate. So this is the basic introduction. I have cleared you about the autonomic dysreflexia. So you can see here, the autonomic dysreflexia is a condition of the autonomic nervous system, in which the hyperreflexia condition of the autonomic nervous system here. So in basic introduction, we see the autonomic is divided into the sympathetic nervous system and the parasympathetic nervous system. So here, in case of the SNS called the thoracolumbar and PNS called the craniosacral. So here I have explained you cranial and about the spinal nerve controlled by the PNS. And in the autonomic dysreflexia condition, injury below the T6 vertebra. So if there will be the breakage of the T6 vertebra, no any signal can be transferred from the lower tract to the brain. So condition called as the autonomic dysreflexia. So this is the basic introduction of the disease. Now we will move to the symptoms, like which kind of the symptoms will be there in case of the autonomic dysreflexia. So see here, I will clear you about the some symptoms. Okay, so see here, if there will be stimulation from lower body or the extremities, then sympathetic nervous system will be activate. This will work. So you can see here, here is injury up to the T6 level. So if there will be any stimulation but can't pass up to the brain, because here the breakage level. So means you can see here, the sympathetic nervous system will stimulate if there is like signal or the stimulations coming from the lower body. So you can see, and sympathetic nervous system leads to vasoconstriction. Okay. So sympathetic nervous system will do the vasoconstriction. So we easily know, if there is a concept of the vasoconstriction, there will be directly the condition of the hypertension, or we can call is increased blood pressure. So if the condition here, like the increased blood pressure, vasoconstriction, so upper body will stimulate, then parasympathetic nervous system. Because if the brain will try to overcome, but not here, because it can't be crossed this, because there is an injury, T6 level. So there, when the like our brain stimulate or our the spinal cord stimulate the parasympathetic nervous system to overcome this situation. So we can easily see here the symptoms right now. This is easily cleared here. So in the lower extremities, sympathetic nervous system will stimulate and lead to the vasoconstriction. So if there is a concept of the vasoconstriction, that directly lead to the hypertension. Okay. And secondly, we can see here, there is enriched blood supply. We can say that the more blood supply in the upper part. So we can see here that lead to the increased pressure in the upper extremities or in the head. So here a condition develop, headache. And the pressure in the upper extremities will directly severely, like we can call it the severely more pressure. So it can called as the pounding headache, in which there is more than 200 mm of Hg blood pressure. So here the pounding headache or the pounding hypertension will be there, means blood pressure more than the 200 mm of the Hg. So in the upper extremities, the PNS will be activated, and in the lower extremities, sympathetic nervous will be activated. So here, if the sympathetic nervous will activated, there is a concept of the vasoconstriction that directly lead to the hypertension. And if the PNS is activated, so you can see here PNS do the vasodilation. So if there is vasodilation, means you can see here the increased flow. So when there will be the increased flow, it will lead to the flushing of face, and it directly put impact on the retina. So due to the increased pressure, there will be blurred vision. Okay, so these are the some common symptoms. So hypertension is the classical sign and symptom of the autonomic dysreflexia, and correlating symptom other like headache, flushing of face, like the blurred vision. These all are also the symptom of the autonomic dysreflexia. So now come to the question here. Hope so you have cleared some things. Okay. So you can easily see here, like T6 injury resulting in the paralysis below the chest. Here, this is in a common diagram where I have explained about the C4, C6, T6 and L1 injury. And you can see here the concept of the hypertension. You can see here the irritation below the point of the spinal cord injury, and that lead to the nerve signal blockage up to the T6 level. And if there is a blockage of the T6 level, no any signals will be transmitted to the brain. So brain sends signal to the lower pressure, but these are also blocked by the spinal cord injury symptoms. So here in the result is sweating and the severe headache also result. So this is the basic concept of the autonomic dysreflexia. So once again, I'll clear you about the symptom here, like increased BP and the headache, flushed face, distended neck veins. So why the distended neck veins? Because when the brain will pass message to the upper extremities, here you can see the carotid arteries. So flow will be increased due to the vasodilation by the parasympathetic nervous system. So here our neck vein will also distended, but the heart rate will be decreased, increased sweatings. So all these are the main symptom of the autonomic dysreflexia. So hope so you have cleared this disease, the autonomic dysreflexia. So the right answers we will find here. So blurred vision, as I have explained you, due to the concept of the vasodilation. Okay. So vasodilation here, the dilation of the pupil, and it directly put impact on the retina that can form image. So here the symptom occur, blurred vision. Next is the increased blood pressure. This is also in why the increased blood pressure. So I have explained you here the brain and injury up to the T6 level. So below, in the lower extremities here, below than T6, there is a SNS will activate, and in upper extremities, parasympathetic nervous system will activate. So in case of this, if the sympathetic nervous system will activate, so it do the vasoconstriction, and we know vasoconstriction directly lead to increasing the blood pressure. Next is the severe headache. This is also the right answer here. Severe headache, because there will be the vasoconstriction, and also the when there will be the increase in the blood pressure, severe headache is normally commonly a symptom of the increasing blood pressure. So here, pounding condition means when blood pressure is more than the 200 mm of Hg, the patient will suffer from a severe headache. Next is the sweating. So sweating is increased. Sweating will also increase because the patient sympathetic nervous system and parasympathetic nervous system are the affected due to the spinal cord injury here. So these there are the right answer. Option number B, D, E, and H are the right options. Here next, question number 2. The nurse is providing education to a client who has scheduled a positron emission tomography, or we can call it a PET scan. During the instruction, the nurse explains the importance of avoiding certain foods and liquids for a specific period before the scan. These restrictions aim to ensure accurate and reliable scan results. The client should refrain from consuming the following items from 24 hours prior to the scan. Select all that apply. So we will find the strategy and recognize the cues regarding this question here. So means patient is going for the PET scan, and here the directly question is related to the diet. Means which kind of food the client should refrain before the 24 hours prior the scan. So means diet to we avoid. Question is asking about which kind of diet or which kind of item should be avoided by the client when he have to go on for a PET scan after 24 hours. So it is also SATA based question. So let's see the option like alcohol, caffeine, egg, meat, milk, pasta, rice, sugar. So we have to find out the right answer. So let's solve this question. Okay. So as we all know, PET scan is a radiological study of the human body in which we have to insert a radioisotope. Okay. So radioisotope, if we come to this concept of the radioisotope, it is directly a glucose transporter. Okay. So glucose transporter, so we can say that it tend to accumulate in the metabolic active areas of the body. So if there will be increased glucose level in the body, so it can lead to increased insulin level in our body. And we know glucose comes from the carbohydrate rich diet. So directly here means client have to avoid the carbohydrate rich diet. So once again, I'll explain you like PET scan. PET scan is a radiological examination or the radiological tool of the diagnostic evaluation. So in which we insert a radioisotope into the client's body. And radioisotope is directly a glucose transporter. Means it can increase the actively metabolisms in different area of the body. So if there will be the elevated level of the glucose, so elevated level of glucose will directly lead to increased insulin level. And if there will be insulin level increase, the patient will suffer from the hyperglycemic conditions. So we have to avoid the carbohydrate rich diet because glucose comes from the carbohydrate rich diet. So let's see. You can see here this chart, food to be eaten and food to be avoided. So we have to avoid some certain list of the food like the cereals, pasta, okay, milk, bread, sugar, and caffeine. So like sugar, milk, all these contains the carbohydrates. And caffeine is a diuretic. Sometimes it's like play a role of the diuretics. So these dietary guidelines help. These dietary guidelines directly lead to increased glucose level. So we have to avoid this kind of the food, and we have to eat like the meat, hard cheese, tough eggs, butter, and non-starch vegetables. So let's come to the question. Now we can easily choose the right options here. So as we have discussed in the previous chart, like the alcohol, caffeine, milk, rice, sugar, we have to avoid in the patient prior the scan, means 24 hours prior to the scan. So we have to avoid this. So these all are the right answer here. Next question here. Which sign and symptoms when observed in the 30-year-old individual who work as a teacher and has the type 1 diabetes may indicate the possibility of the ketoacidosis? Select all that apply. So means directly here, it is also a SATA based question, and in which we have to choose the possible indicative sign and symptoms of diabetic ketoacidosis. So let's see the option here, like what will the possible indicative of the diabetic ketoacidosis? Maybe confusion, bradycardia, Kussmaul's breathing, abdominal pain, fruity smell, breath, anuria, lack of thirst. So we will find out the right answer. But firstly, we have to clear about the diabetic ketoacidosis. So we know that the diabetic ketoacidosis is a serious complication. Is a serious complication of diabetes. Okay. So like, what is the diabetic ketoacidosis here? So in which, if the diabetes mellitus will left untreated, there will be more acid ketones production that can also lead to the metabolic acidosis. If the diabetes mellitus will remain or like the left untreated, so you can see here there will be more and more the ketone acid production in the human body, and that can lead to the metabolic acidosis. So this is the serious complication of the diabetes mellitus. So it has the, and why this can be important to know about the signs and symptoms of the diabetic ketoacidosis, that we can easily find out in the patient about the symptoms of the diabetic ketoacidosis. So we know when if the, you can see here, the body is unable to use the glucose as an energy. So due to the insufficient insulin, it start break down fat for the fuel. And when there will be the more and more fat breakage for the fuel, there will be that lead to the production of the ketones. So here I have explained you more and more acid production that will lead to the metabolic acidosis, and this condition is called the diabetic ketoacidosis. So we will discuss about some symptoms regarding the diabetic ketoacidosis here. So like the blurred vision, retinopathy. Blurred vision will occur due to the retinopathy. And how the retinopathy occur, or what is retinopathy? It is a microvascular disorder in which, due to the increased demand of the body and increased blood glucose level, there will be the damage of the optic nerve, and it will lead to the retinopathy, blurred vision, etc. So high blood sugar levels, high ketones. So we can see here, if there will be the high ketones, it can lead to the acetone breath. Stomach pain or feeling or the being sick. So it is due to the metabolic acidosis condition. It directly put impact on the main site of the metabolism, and the main site of metabolism is our liver. So directly lead to the stomach pain or abdominal pain, confusing, passing out. So confusing or the disorientation here. So it is due to the neuropathic condition. Like the retinopathy, here also a complication, that is the neuropathy. So patient will suffer from the disorientations or some confusions and feeling tired and sleepy and increased demand of the body. So why the feeling tired and the sleepy? Because body demand will increasing for the fuel or for the energy. So it will lead to some symptoms like the trying, tired up, or the feeling and the sleepy here. Next here, the small breathing. It is the main characteristics or the classical sign and symptom of the diabetic ketoacidosis. So why the diabetic ketoacidosis here? Small breathing in the diabetic ketoacidosis here. So firstly, small breathing meaning, it means the rapid and irregular breathing. Okay. So small breathing means the rapid and the irregular breathing here. And small breathing seen in the basically the metabolic acidosis. And metabolic acidosis, I have explained you earlier, like the diabetic ketoacidosis is the main cause of the metabolic acidosis. So this and some other conditions like in the diabetic ketoacidosis, uremia, sepsis, salicylate aldehyde, and lactic acidosis. In all these conditions, there will be the higher chances of the patient for the rapid and the irregular breathing. And due to this, there will be the low serum bicarbonate here in case of the metabolic acidosis. So hope so you will easily able to the concept of the small breathing, that will be the rapid and the irregular breathing, and it is the main characteristic of the diabetic ketoacidosis. And there is a one thing, that why the small breathing occur in the diabetic ketoacidosis. So it occurs for the compensation of the metabolic acidosis. Means when the body try to compensate from the metabolic acidosis. So here a condition occur here like the small breathing, in which patient deep and rapid breathing and the irregular breathing here. So this is the concept of the small breathing. Second will be here the acetone breath. So acetone breath, so I have explained you, due to the excessive acid like the ketone production. So when there will be the excessive acid ketone production will be there, so it lead to the fruity smell. Fruity smell like breath. So second is basic characteristics of the diabetic ketoacidosis is the acetone breath or the fruity smell of the breath. So there are the some three main categorization or the three main symptoms of the diabetic ketoacidosis. So hope so you will easily able to understand this. So see here the right options like confusions. So I have explained you due to the concept of the neuropathy plus insufficient supply of energy or fuel to brain. It will lead to inability to work proper of the brain. So here will be the confusions and the disorientation. Okay. Next option is the Kussmaul breathing. So I have explained you about the Kussmaul breathing. So why it occur? It is the main characteristic of the diabetic ketoacidosis in which patient will breathe like rapid and deep respirations. Okay, and it occurred due to for compensation of metabolic acidosis. So C will be also the right option. Next is there the abdominal pain. So I have explained you about the stomach pain, abdominal pain, because it directly affect the metabolism sites like the liver here. So pain will occur in the individual stomach or the abdomen. And next is the fruity smell or the breath. So fruity smell breath, like here we can call as acetone breath. And how it happen? Yeah, how it occur? So it occur due to the acids or the ketone production. Okay. So patient breath automatically convert to the fruity smell like breath here. So it is a concept of the next option. And lack of thirst, anuria, lack of urine production, bradycardia, these are the irrelevant options. So these will not the correct option here. So A, C, D, and E will be the right answer of the MCQ. Okay. So in today's lecture, we have discussed about the three conditions: autonomic dysreflexia, second is diabetic ketoacidosis, and next is about the PET scan. So easy autonomic dysreflexia is also called a hyperreflexia condition in which directly affected autonomic nervous system, which is divided into two systems, that is our sympathetic nervous system and the parasympathetic nervous system. So sympathetic nervous system will responsible for the stimulation of lower extremities, and parasympathetic is responsible for stimulation of upper extremities. Okay, so we have discussed about their sign and symptoms or how they will affect during the T6 injury. And autonomic dysreflexia is a main condition when there is injury above the T6 level or the thoracic 6 level. So we have discussed about the diabetic ketoacidosis, in which when there will be the insufficient amount of the glucose in the body, or sorry, insulin in the body. So our body starts breaking the fat into the fuel, and it will directly lead to the acid productions. We called it ketones. So it is a condition, diabetic ketoacidosis. It is a complication of the diabetes mellitus. And next condition about the PET scan. Like in the PET scan, we insert the radioisotope. Okay, so radioisotope is a glucose transporter. And how the glucose transporter? So it can lead to the increase the metabolic activities in the body. So we will avoid some food that is enriched in the carbohydrates. So all these conditions we have discussed. So hope so you able to understand. and you can easily able to find out the answers of the different kind of MCQs here. So thank you. That's all about my lecture.